All right, hello and welcome to the first session in the Safe Systems Summer Learning Series presented by the Collaborative Sciences Center for Road Safety, or CSCRS. My name is Kristen Brookshire and I'm a research associate at the UNC Highway Safety Research Center where CSCRS is housed. I'll be here to give you guys a quick orientation and then hand things over to our moderator, Dr. Laura Sandt. So our consortium was established in 2016 as one of the 5 national university transportation research centers funded by the FAST Act, aiming to address our nation's critical safety issues. We are a consortium of research partners from 5 universities, shown on the slide: UNC, Duke, Florida Atlantic University, UC Berkeley, and University of Tennessee at Knoxville, with many of our students and researchers participating in or helping to moderate this series. Oops, sorry, just one moment. All right, so if you are not yet familiar with CSCRS, our consortium recognizes that transportation challenges are increasingly complex and interconnected, and this demands new skills and approaches to problem solving. We bring together expertise in engineering, planning, robotics and data science, public health, and other fields to develop new ways to approach our most enduring and complex safety issues. So 2 years ago, our consortium held its first conference, the Safe Systems Summit, and it was organized around 2 oh, I'm sorry, got computer problem, just one moment. Okay, so the Safe Systems Summit, in this series, we introduce concepts around safe systems and system science, which can be used to explore system assumptions and concepts to reflect upon the ways in which we as a research and practice community can both appreciate the complexity of the transportation system while continuing to foster shared goals and identify innovative new ways to address enduring safety issues. So for today, I want to remind everyone that the session is being recorded and that it will be posted online after the fact. We encourage you to submit your questions via the chat, and if you'd prefer to ask them verbally, just let me know and I will unmute you. You can also share in the chat any papers or other resources that you think are relevant for the group gathered today. And with that, I will pass the mic to our moderator for today, Laura Sandt, who is the director of CSCRS. She is active in a variety of research areas, including the development and evaluation of community-involved health and injury prevention programs and studies focusing on pedestrian and bicycle safety, mobility, and access. Laura?
Thank you, Kristen. Thanks for kicking us off. And I know we always have some glitches when we launch new series, so appreciate your patience with the slides. But as Kristen mentioned, we have been a center for the last few years, since 2016. And one of the more exciting things that I really love about the work that we're doing is bringing together different perspectives to talk about these complex safety issues. And one of the things that we used to do before the pandemic was have what we called coffee and conversations. We had a lot of kind of intimate discussions, trying to share not just scientific and technical literature and expertise, but really allow ourselves to have some philosophical and intellectual discussions about these issues over a semester-long time period. And so the thinking around this series is that we could expand upon those kinds of campus-based seminars and just invite a larger crowd, a larger set of stakeholders and perspectives into the conversation to talk about what we mean when we're talking about traffic safety, because that is in our center's name, this Collaborative Sciences Center for Road Safety. And a lot of our work has been talking about this concept of safe systems. And what do we mean when we talk about prioritizing safety, creating a safety culture, and that kind of thing? It really begins with reflecting a little bit on what we mean by safety and what data and tools we bring into that definition. And so I'm really thrilled to have three of my really truly favorite colleagues here to have this conversation. We've talked one-on-one and in other groups about these issues for a long time. And this is just our first chance to kind of get together and kick off this series. And I know we've got an audience here that can't always be seen and heard in this webinar platform, but we do invite you to introduce yourself on the chat. If you want to do that, and at some point in time, we'll be making sure that we're engaging you with any thoughts and questions that you have to share with this panel. But we brought these folks together with the idea that we would really begin to explore this definition of safety and see if we can kind of unpack all of our sometimes unspoken assumptions around that. And so with that, I would like to turn it over and introduce our three panel members and just read off their bios to you. So first we have Megan Wier. Megan is the Safe Streets Division Manager for the City of Oakland's Department of Transportation, and she oversees the bike and ped program there, including traffic engineering, traffic maintenance, and signal operations teams that strategically advance a safe, equitable transportation system for the Oakland community. And prior to joining Oakland in early 2020, Megan was the director of the program on health, equity, and sustainability at the San Francisco Department of Public Health, where she worked for over a decade at the intersection of health, equity, and transportation in partnership with city agencies and community stakeholders. And she carries a master's degree in public health from UC Berkeley, which is one of our consortium members. So we're happy to have her as a friend and affiliate here. Next in our panel, we have Charles T. Brown, who is the founder and principal of Equitable Cities, a minority and veteran-owned urban planning, public policy, and research firm focused at the intersection of transportation, health, and equity. He is also an adjunct professor at the Edward J. Blaustein School of Planning and Public Health at Rutgers, and previously served as a senior researcher with the Allen M. Voorhees Transportation Center there. He has authored several groundbreaking national and local studies that have really redefined how we analyze the role of race and racism in transportation and mobility. And in 2020, he was part of the inaugural class of Public Voices Fellowship on the Climate Crisis, managed by the Yale School of the Environment. Charles is a military veteran, recipient of the Mississippi Commendation Medal and Global War on Terrorism Service Medal. And he also carries a master's degree in public administration and graduate certificate in urban and regional planning from the University of Central Florida. And then last but certainly not least, we've got Jamila M. Porter. She is the Senior Advisor for Program and Strategy at the Beaumont Foundation. She serves as Strategic Advisor to the CEO, executes and supports organizational priorities, and works across teams to drive results throughout the foundation. Prior to this role, she was Director of the Resilient Communities with the Big Cities Health Coalition. And in that role, she led their efforts to build healthy, resilient, and vibrant communities across our nation's largest cities by utilizing expertise in systemic equity, racial justice, violence prevention, and policy. And she carries a master's degree and doctorate in public health. So welcome to our panelists. And now I would invite you to make sure you are unmuted. And I guess we'll start with our first question in the series. Just now that people have heard your official bio, we might let you just go in your own words, tell us a little bit more about your own personal and professional journey through these fields that you all have been walking through around transportation, health, equity, and injury. And just tell us, how you think you've seen safety defined in your work, and what do you see in need of change? And Megan, maybe we'll lead off with you.
Thanks so much, Laura. And I first just wanted to say thanks so much for the, for the opportunity to participate in today's panel, for convening all of us for this important and really timely discussion, on critical issues facing our communities and our society. And it's really an honor to be here today with my esteemed panelists. So thank you. I'm going to start, I think, just talking about a little bit about my personal journey, as you asked, and then reflect on safety. I started working, and realize and reflecting on this question at the intersection of health and transportation. When I started my career in New York City, working for a nonprofit that provided services for youth in the foster care system, including our pregnant and parenting teenagers. And as New York City looked to develop a community-based foster care system, we conducted focus groups with the young people we were serving. And like very quickly, I think as in many conversations regarding what are the needs of communities, transportation rose really like clearly to the top. And so was there prior to using GIS that I developed my first really crude map of New York City's transportation system, where our services were located, where healthcare clinics were located, and where families were for the young people we served across the boroughs. And in this role, I also became really acutely aware of the importance of data, to inform public policy decisions, and then pursued a degree in epidemiology and biostatistics at UC Berkeley, just knowing how important it is as we're engaging in public policy discussions regarding the allocation of resources, how powerful, those fields are with respect to having a robust toolkit to be able to engage in some of the challenging debates that we have, where comfort with quantitative data can be a deal breaker in some of those discussions. And shortly after that, I began my work at the San Francisco Department of Public Health, where I had the opportunity to learn more about pedestrian safety, conduct some quantitative modeling, and quickly became even more aware, I think, of some of the tensions between science and public policy decisions with respect to, what is the evidence and what are we actually doing with respect to where are we prioritizing and investing our resources. I did a lot of work there on health impact assessment, so developing tools to assess the comprehensive impacts of public policy decisions on transportation. And we'll say I've been really heartened, over the course of my career at, initially going to TRB, the Transportation Research Board meeting, and having people in the room ask questions like, what is public health and why do public health practitioners keep showing up, in our meetings? And now, that the TRB has a health and transportation, a formal committee, that's really comprehensively working to address issues of health and transportation and equity. In San Francisco, I led I co-led the city's Vision Zero work. San Francisco was the only city in the country, to my knowledge, where public health and transportation co-lead that work, and we really focused on equity, on partnering with agencies across the city, as well as within public health and trauma surgeons, to advance Vision Zero goals and elevate the importance of equity and community partnerships. And now I'm really privileged to be in my Safe Streets Division Manager role for the city of Oakland, where this spring we launched our Safe Oakland Streets initiative, which is focused on reducing severe and fatal injuries and disparities to Black, Indigenous, and people of color communities, our low-income communities, seniors, and people with disabilities, and also ensuring that the efforts that we initiate towards those goals do not have disproportionate impacts on those same communities. We also have our Slow Streets and Essential Places program that we launched during the pandemic, and a number of other things that I look forward to touching on in more detail during this discussion. But reflecting on safety, I've always been very cautious about using that word, because I think that safety can really mean so many, so many things and so many different contexts. So they, for today's discussion, it being really important to be really explicit about, what are our goals when we're talking about safety. And I think some of the, like a lot of the value of, from my experience in initiatives like Vision Zero and a safe systems approach and how they're implemented is that really explicit focus on defining outcomes and goals of initiatives, but also, for safety and for the crises that our communities are facing, needing to be really explicit about the importance of elevating equity towards achieving those goals. So making sure that we're very explicit about, who is the most impacted when we're talking about safety. Where are we focusing our resources, and in doing so, and defining safety, engaging with communities that are the most impacted as well. So bringing all of those pieces to the table as we work to define what are the needs of our communities, what is safety, and fundamentally, for local governments, how are we prioritizing our resources to address those issues? I'm really looking forward to today's discussion.
Thank you for that recap of some of your work and some of how you've been thinking about safety. Charles, can we hear from you next?
Sure. Good afternoon, everyone. Thank you, Laura and the team again for having me here. My journey, if I'm honest, started with my desire to be the director of the FBI as a kid, because as a young kid, I always thought that, I would fight for the underdog, I would protect everyone. And so I thought being the director of the FBI is where I could pursue my goal of ensuring justice and safety for everyone. My more immediate journey, however, through the transportation, health, and injury field started back in 2000, when I started working in a private Black-owned engineering firm in Jackson, Mississippi. Since that time, I've been fortunate to work with, as you know, other privately owned firms across the country, as well as having worked in the public sector at the City of Orlando, academia with Rutgers. I've served in the military, and now I serve, as CEO of my own company, Equitable Cities. What I could say about these experiences is that they have led me to identify as a street level researcher and as a pracademic. And what I've seen in terms of safety, in terms of how it's been defined and how it needs redefining, is that in transportation, safety usually refers to traffic safety. My challenge over the years, however, for our industry has been for us collectively to strongly consider the importance of focusing not just on traffic safety, but also personal safety. I guess that goes back again to my desire to be an FBI. This is extremely important when we sort of consider the concerns that racialized minority groups, women, persons with disabilities, immigrants, and sexual minorities have when traversing our roadways throughout America, whether it be city, suburb, or rural environment. And it becomes increasingly important too when we consider that recent data shows that in 2019, there were 814 incidents of race-based hate crimes on America's sidewalks, roadways, and highways. Lastly, I would say in terms of safety, we must consider it through the lens of how law enforcement and self-deputized white citizens discriminate and harm Black and brown citizens. And this is why, as of late, my focus has been on elevating the conversation around arrested mobility. Thank you, Laura.
Thank you, Charles, so much for that. And I think we'll touch on a lot of those issues in some of our discussion. Jamila, can you come on and tell us more about yourself?
Sure, and thank you so much, Laura, and the entire the CSCRS team for inviting me to be here today. It's just really a pleasure to be on this panel and to have this really important and just really compelling conversation with all of you. So for me, my journey started in the middle class suburbs of Atlanta, where I grew up. I did not grow up in an interconnected, walkable community. I grew up, I grew up in a nice middle class neighborhood, but the idea of like having sidewalks and being able to like, walk from, your home to like a destination was just not how this community, how communities and suburbs are designed, even now here, and I'm in Atlanta still. And so the idea of being able to like driving everywhere, that's just how you got places. And I think that understanding of the interconnectivity that I think people who reside in urban areas sometimes take for granted. I didn't really even get to know that until I worked in the heart of the city after graduate school and was like, oh, this can be different. So, but at the same time, when I was growing up, I always loved the idea of helping people. I think, just my experiences growing up, I always wanted to do something like around public health. I've been a public health geek for a really long time. I loved the TV show Captain Planet. So I wanted and still want to be a Planeteer. And I think that those connections between health and environmentalism and transportation eventually connected really beautifully for me. I came of age professionally in my health and transportation journey when I was working at the Safe States Alliance, which is an association of injury and violence prevention professionals. And at the time we were working with the National Highway Traffic Safety Administration on like safe routes to school. And it was around that time that President Obama got elected and kicked off the Partnership for Sustainable Communities. And that was a unique partnership between HUD, DOT, and EPA that had a holistic focus on livability and a goal of ensuring that those three agencies' policies and programs and funding were interconnected and integrated to address affordable housing, transportation, and environmental protection together. So although to this day I am salty that public health is not explicitly invited to that partnership, so public health people, HHS, CDC, let's figure that out. From the public health side we were funded through NHTSA to work with state injury and violence prevention staff and their state DOT colleagues to learn about, at the time we were talking like speaking in a common language. What does surveillance mean to us as public health professionals? What does surveillance mean in transportation? And just getting our words together and being able to connect in that way. And then that would, at the time was, it was thought that could start partnerships and allow public health professionals from the injury and violence prevention world be able to connect with transportation and work on common goals related to community design and road safety. And that was really inspirational for me. It inspired me to conduct my dissertation research later on complete streets and to conduct the first study that examined the impact of a transportation policy on a health outcome. So in this case, it was a state complete streets law on pedestrian fatalities. And spoiler alert, there was a quantifiable positive impact. And so I think the desire to be able to show that transportation policy is health policy, and that health policy, it can be transportation policy, really is something that I've grown to really embrace and want to uplift. And then I went on to the Big Cities Health Coalition, where I learned so much about our nation's 30 largest big cities. It's a forum for the 30 largest cities in the nation, who are all the health departments of those cities working to collaboratively address major issues for urban areas and big cities. And in the coalition, addressing community violence and addressing structural racism as a public health crisis is huge and is important to them. And I was able to connect that work to the concept of safe streets and how transportation and safety are connected to community violence and the perception of what safety means holistically. And now at the Beaumont Foundation, I really want to explore, the innovation that philanthropy can bear in this space. As for defining safety, I would say I've seen it defined far too narrowly and unjustly. So in the transportation space, safe streets are often defined as safety for motorists and not for the people who are attempting to walk, bike, roll, get through and travel freely along our streets. And just as Charles noted, in Black communities and in communities of color, safe streets means that it means safety from vehicle violence, but also gun violence and police violence. And so systemic racism is the connective tissue between all of these issues. And so that's why I think safety is a form, is justice. And it always makes me think of a quote by the civil rights advocate and the author and attorney Brian Stevenson, who says the opposite of poverty is not wealth, the opposite of poverty is justice. And I would say that applies to safety too. Road safety isn't a transportation issue alone, it's a health issue, it's a racial and social justice issue, it's an economic issue, and ultimately it's a moral issue.
Fantastic. Thank you. Thank you, Jamila, for that introduction. And, just hearing from you all, it seems like you've all lived many, many careers already in a very short lifespan and walked, as Charles would say, at the street level research perspective in a lot of different places. And the connective tissue between you all is just this desire, as I heard you all say, to help people, to root for the underdog, as Charles said, and to help provide access. And one of the observations we've made about safe systems, as you all I think have begun to note already, is that safety programs often live in their own little silos. We still think of safety as different and disconnected from health. When we look at local plans, we see a safety group that is functioning very differently from a livability group or a complete streets initiative, or even a transit initiative. So can you all just speak a little bit more about where you see safety intersecting with these other issues and with these other initiatives, and how can we update and redefine that definition of safety to help bridge those connections? And I think, Jamila, you were already starting to speak to that with the the intersectionality and that looking at the the underlying root issues that affect all of these. So do you want to expand on that at all?
Sure. And it's just, Laura, you just said the word intersectionality, and it just made me think about just now about that we need to, the importance of zooming out and looking at things intersectionally, both literally, we talk about intersections in the road safety space, right? Of course, road engineering, but then intersectional in terms of the way it's defined in the social justice space around looking at multiple the identities that people have, those intersections of our different identities as a woman, as a person of color, as a person who grew up in a middle-class household, like all of these different identities that we all have and subscribe to, and how that influences and changes what safety means for us in public spaces and in any space, right? So I think just as you said, we have to look at this intersectionally, both in terms of how we know it in the road safety space and also how we know it in terms of identity and populations that have many marginalized identities, and what did safety mean for those of us who are marginalized. I'll also say that in the transportation safety space, we've used a lot of different concepts and ideas. So several decades ago, we were using the term routine accommodation to talk about infrastructure needs for pedestrians and cyclists. We've talked about complete streets, and in the research that I referenced, I found that the law that Florida adopted a complete streets, what is now would be called a complete streets law, about 4 decades ago. And the law has had an impact. It saved nearly 3,500 lives over 30 years. But we know that wasn't enough to put a real dent in the systemic inequities in the state's transportation system. For folks who've read the most recent Dangerous by Design report from Smart Growth America, we know 7 of the deadliest metro areas for pedestrians are in the state of Florida. So I think policies and approaches like safe systems, like Vision Zero and Complete Streets, they'll fall short, and they'll continue to fall short if we don't fundamentally reorient how we think about safety, for whom we're making roads safe and the people we're not making them safe for. And if we're not making roads safe for the most marginalized among us, then they're not really safe for anyone. I also think that these approaches were conceived without taking into account our nation's past and our nation's history and what we know about the United States. You know, we're starting from a drastically different point than our counterparts in other countries. In Europe, other areas, they do have systemic oppression, but it is codified in the US Constitution, right? So our nation was built on structural racism. And so we have to acknowledge that and implement, and if we want to implement safe systems approaches, complete streets, others, we have to start with equity and justice as central ideas that we know aren't explicitly built into these approaches. So we have to put them in there. We have to intentionally build around those particular ideas. I'll pause there, but I could keep going.
Yeah, no, that's great. Charles or Megan, do you want to jump in?
I do. Thank you. To hear everything Jamila said, and then also some other things that came to mind are that, you know, in talking about how we're defining safety, I started my my role as a Safe Streets Division Manager at the City of Oakland the second week of shelter in place for the COVID-19 pandemic, and thinking about safety and health, and frankly the crises that are facing our communities and our society, you know, in addition to a persistent safety on our road safety crisis that we've seen, you know, with the recent coverage of disproportionate impacts, you know, persisting and being exacerbated for communities of color during the COVID-19 pandemic. We have a climate crisis. We have affordable housing crisis, and people literally living on our streets, and usually in some of the most hazardous, you know, places. We also have the ongoing crisis of systemic racism embedded in all of these crises. Since I started here, we've also been responding to the wildfire season, you know, as a result of our climate crises. The same vulnerable communities are disproportionately impacted, you know, by all of these issues. So we really need to lead with equity in all of these responses, but also we don't have time to wait to continue to act in silos. And I think with the Safe Oakland Streets initiative, it's an interagency initiative with our Department of Race and Equity, with our City Administrator's Office, with our police department, and a growing number of city agencies, as well as community partners. The COVID response is another model, but in order to address these entrenched and urgent issues, we have to act, you know, across silos, build these interagency partnerships, and go deeper in terms of how we're engaging and resourcing, you know, the community partners that we need to address these issues through. Here in Oakland, we're working on how do we improve our community-based organization and contracting system so that we're, you know, more agile, in engagement, and then also paying our partners for the work that we're doing. I have a lot of other thoughts like Jamila, but I'm gonna stop to allow some more time for others to speak.
All right, thank you.
Yeah, to add on, I think I agree with everything that's been said, but I do think it's debatable as to the degree that these initiatives have been separate, siloed, or void of the involvement and alignment with these other initiatives. I say that because I think there are cities that do a great job of prioritizing and investing in all these initiatives. And there are cities that do a bad job of investing and prioritizing these initiatives. Unfortunately, those doing a bad job of it make the news. And we all know that if you're not making the news, whether print, TV, or social media, no one believes that you exist, or certainly don't believe that your programs are successful. What is less debatable, however, is the degree of which we automatically go to Europe for programs and initiatives without regard for America's uniqueness. Notice I didn't say exceptionalism. And this is in regards to chattel slavery, its criminal justice system, and its policing culture, police culture. And matter of factly, and more importantly, its history of structural racism or anti-Black racism. Given this history, when we think about safe systems and Vision Zero, those programs that are doing it wrong, I should say, we'd be less inclined to consider enforcement over infrastructure investment in our pursuit of safety, healthy and more livable cities. We hesitate because if we were made aware, we would note that the trend of fatal police shootings in the US seem only to be increasing. I pulled data and it showed that a total of 440 civilians have been shot, 74 of whom were Black in the first 6 months of 2021. So this is post George Floyd. And we are also finding that still overwhelming percentage of Black respondents in a recent survey, somewhere like 77%, feel that police do not treat Black and white citizens equally. And so any system, to kind of wrap up here, that doesn't center the importance of racial equity in that system is a failed system to begin with. Thanks, Laura.
Fantastic, powerful.
And Laura, I wanted to add to Charles's point that we always talk about data, the data we have, the data we don't have. That's data that we aren't connecting, right? Like, so when Black and brown people are shot and killed in traffic stops, like that is traffic safety data that needs to be integrated into to fully understand the adverse impact of policing on Black and brown people. And so those are, I mean, I know we may talk about data in more detail later, but I think these are the missing data, the unseen people, the invisible data points that are needed. And, I'll also say in data conversations, I've also heard like, we have all the data. We have the data we need. We're just not acting on it. I believe that both things are true. I think we have data that we're not acting on, as Charles just talked about. And then there are other data that need to be collected and connected so that we can make stronger, better arguments about what's really happening in communities, so that police shootings aren't seen as a random act by an individual, but we can see them as truly systemic, common pattern occurrences that are adversely impacting our safety goals.
Well, let's stay on that topic of data then, because I know in the research community, looking at the injury prevention literature, our traffic safety literature, we all the time see safety papers about safety that really are just quantifying it in terms of crashes, fatalities, and sometimes injuries, which are clearly the ones that we've been figuring out how to measure and observe for a long time. But as Charles mentioned, we have a lot of these personal safety issues that are maybe less seen or unseen, or maybe even intentionally ignored, around discomfort, intimidation, fear, and then certainly these actual events that you totally can see around race-based hate crimes, and other events. And then, Megan brought up the issues of affordability and changes in climate. These are measurable things. What are the barriers that you're seeing that we're not making those connections? Or how do you think, what advice would you give to the research and practitioner community that's showing up here to make those connections stronger, to integrate those data sources when we are talking about safety?
Well, Laura, I think it's funny but not funny. I think when it comes to unseen barriers, we treat unseen barriers like unmarked crosswalks. We don't want to really address the reality that people belong there. And so this is one of the main reasons why I identify first as a street level researcher. And I challenge others to understand that this equity work that we do is much more than a desktop exercise. You can't be about equity and stay at your computer 24/7 without engaging with the people. Because my street level research across the country has shown me that the unseen barriers, I like to say, can be categorized under the letter S, as in Sam. So those barriers include signs, symbols, statues, structures, streets, surveillance, and as I talked about earlier, the growth in the self-deputization of white citizens. See, collectively, these things glorify people who perpetuated slavery. They are painful reminders of past and present institutionalized racism. They re-traumatize racialized minorities. And when you consider these realities alongside the fact that our communities are segregated by race, an unseen barrier is just as powerful as a seen one. The issue is that our social scientists, another S, in our schools, which lack diversity, are unable to see this because they don't have a direct connection to it. And this is why conversations that involve racialized minority groups as well as women are important, because we help point out what is unseen.
Megan or Jamila, do you want to add to that?
Sure. I mean, I think a huge, like a key to addressing safety and for communities most, most impacted is the need for us to strengthen, like per Charles' comment on street level research, strengthen our capacity for engagement with the communities most impacted so we can be responsive to the needs. And these are people that, often are working multiple jobs, are not, showing up, able to participate in, community engagement meetings as we've structured them. So, through our work in Oakland, recently last year, we were working on a traffic calming improvements on a corridor that's disproportionately impacted by speeding and also gun violence, which is something that we see a lot, in a lot of communities, these same communities being disproportionately impacted by these outcomes. And so because of, as an adaptation to COVID, we ended up doing a community socially distanced walkthrough on a Saturday morning. So, meeting at a corner and walking through the neighborhood with some tactical urbanism, concepts set up at different intersections for people to respond to. And what happened was that while we were doing that, people who are like, going for a morning walk with our toddler, or, people that were, just kind of having a morning coffee came out to join the walkthrough. And we were able to get input from, residents that typically wouldn't necessarily have shown up at a community meeting. So, in order to get the impact that, get this type of feedback, we need to be more creative, and more deliberate in terms of who we're trying to engage to be able to address safety.
I know, Jamila, we've talked in past panels too about the public health approach to engagement and how that, might offer some new thinking around this compared to traditional transportation approaches. Did you want to add anything?
Yeah, sure. Thank you. I was going to say to Megan's point about how these community meetings are usually set up. There's the logistics of the meeting, right? How, like the time that the meeting takes place. These things are decided not by the community itself. So, one might ponder, do you really want the community there? Because you basically put up every barrier you could think of in terms of where it is, when it is, and if you can get there, many times the decisions are already made. So it's really more about getting input on an initiative, a development, an approach that's already going to happen, but we'll just check in with you and see if we can get your, rubber stamp approval for it. And oftentimes in these meetings, and I'd be curious if Megan or Charles have any of these experiences too, the community wants to talk about other stuff. They don't want to talk about this one, road diet you might be talking about. There are these integrated, intertwined issues around road safety and community safety and community violence, and that hasn't been embraced by the traffic safety community, but is keenly understood in those public health violence prevention spaces. And so I absolutely think that working on this together is the way to go for sure, because there's the community engagement piece in terms of more intentionally engaging communities, using not just a meeting, but really engaging in what I know is called collaborative governance, which is a governing arrangement where non-state stakeholders like community members or organized community organizations are deliberately and formally engaged in decision-making processes with the explicit purpose of implementing policy or deciding on how public funds are utilized. And so in a real collaborative governance relationship, communities aren't just consulted, they are directly engaged, they are part of how the sausage gets made. You can't make a decision without utilizing the input, feedback, and experiences and expertise of community. So I think we have to, public health, of course, has done some things, but can always do more and do better. And also our transportation, colleagues and organizations need to really adopt real collaborative governance strategies that, because in my view, that's the only way you can get meaningful and sustained community input that has real impact and is able to see these various, the various issues that communities are grappling with in a more holistic and comprehensive way. And that's how you get to solutions.
There's no other additions from Megan and Charles. I kind of wanted to go back to some conversation we were having a little bit about some of those assumptions we make in safety and whose safety. Jamila, you spoke to that, just being a little bit more explicit about our goals and whose safety we're talking about. Because often we see projects that are billed as safety for all or universal safety, but when you look at our history on our roadways, we see that in many cases it was safety for only a smaller group in power. Maybe it was safety for only a upper class white commuting group that benefited from this particular project. And so, this issue around recognizing and meeting the needs of those most marginalized has come up a lot in this conversation. How do we get even more nuanced in our research and in our practice around these assumptions that we're making around who's benefiting from these safety projects? And maybe it comes from this discussion we're having now about engaging with the public, but just tell us a little bit more about your thoughts on that. And I guess Charles, do we want to start back with you?
Sure, I'll take it. It's funny you say nuance. I think what we need is more clarity. Right? I think we need more specificity around what the reality is on the ground, as well as in the data. I'll give you an example. Smart Growth America released the Dangers by Design report in that outstanding report, Smart Growth America, I want to preface this by saying does amazing work. But in that report, it showed that Black and Native Americans were dying disproportionately as a result of traffic crashes. But then the title said older adults, people of color, and I think people walking in low-income communities. That should be changed to say Black Americans and Native Americans, not people of color. See, what we do is we politicize this language to the detriment of Black and Native Americans in this country. We say BIPOC, we say people of color, we say vulnerable communities because it's safe, because it's the safe thing to say. It's hip, and we don't want to offend anyone. But you are offending people. You are offending the people that are dying disproportionately on our roadways, which are Black and Native Americans, not people of color. And so what we need then is greater clarity, greater specificity in our conversations, because now that we know who is dying, when we talk about safety improvements, those safety improvements should be made in the communities that need them most. And we're not seeing that because when we talk about what is needed in Black and Native American communities, we make the safety for all speech, which is akin to all lives matter in a Black Lives Matter conversation. And so that's what we need. We need more clarity and we need more specificity around who is dying. And then we have to have an honest conversation as to why, if they've been dying, because you can go back to this Dangerous by Design study in previous studies, my entire life, one thing has been true, and that is Black and brown people have been dying disproportionately. But what has also been true is the fact that they have not received a greater share of the resources to address the fact that they died disproportionately. So anytime I see safety for all or safety improvement that doesn't center the importance of racial equity, I know is simply a joke.
I just am so glad, Charles, that you started this conversation about words. The first thing I just want to throw out there, and I will share this link, is that if anyone's ever heard of Frameworks Institute, they do a lot of social science research on framing and language and contextualizing arguments. And so the word vulnerable, that's very commonly used in the transportation space, is actually adverse to getting our goals done. Policymakers, the public, they not only turn off from that word, the word vulnerable, it has an adverse impact. So I'll put that out there as a start about like the language that we're using, and do we know the words that we need to use to get our arguments heard and acted upon. I agree with Charles. I actually like using my personal marginalized communities because I also am on a journey of like, how do we talk inclusively about the many communities, Black communities, brown communities, like that are all tribal communities that are all part of this. And so I do agree that we need to explicitly talk about this, and then also figure out like how we are having common conversations about uniting communities around this work. I, like Charles, also hate the word all, and it is offensive to me in a lot of ways, but I also think that the term equity has been abused a lot. And when I think that it is, it's in vogue right now to say equity and to say that people embrace equity. And equity is really important, but it's not the end of the conversation. It's the beginning. So equity acknowledges that everyone doesn't start from the same place, that communities, marginalized communities, communities of color, so sorry, Charles, Black communities, tribal communities have been harmed by a variety of laws, organizational policies, fiscal decisions over centuries that have intentionally and unjustly disadvantaged them, and thus also intentionally advantaged others. And so if we want to make that right, we have to acknowledge that history and who's been advantaged and disadvantaged purposefully, and then try to address those harms. But then for those who are familiar with Dr. Kamara Jones's work, and I'm happy to drop that link too, equity requires three things. It requires that all individuals and populations are valued equally, that historical injustices are recognized and rectified, and that resources are provided according to need. And just as Charles said, equity and justice require providing resources according to need. That is a conversation about money and investments. And still referencing Dangerous by Design, if we know that there are 7 cities in Florida that are the most deadly cities in the nation for pedestrians, statistically we know those pedestrians are Black and brown, why aren't we pouring disproportionately more money and resources and just collective brilliance into these cities? So that's what equity and justice are really about. It will take a material investment that is disproportionately more. Some places may not get things because they don't need them the way that other places do.
Laura, I'll chime in to this and thank my fellow speakers for their remarks, and also say I think for me this discussion also really harkens back to kind of the initial remarks around like data and starting with like clearly defined goals. So if by safety we're talking about addressing the most adverse injury outcomes on our transportation system, then we need to talk about severe injuries and death, like very, very explicitly. And one thing through our work in San Francisco, or the work that I led in San Francisco, was acknowledging that also the data that we had, to understand these issues was limited, and in that San Francisco at the time, like many other jurisdictions, was relying on police data, which we know, underreports injuries, including, San Francisco had evidence of underreporting for Black residents who are injured, as well as cyclists and people walking. And so as we're working to define our goals, the importance of having the most comprehensive data possible, and to ensure that people are not underreported as we're working to, to focus our investments. And this has, as the example shared, this has significant impacts on where our resources are allocated. Oakland and San Francisco, other cities have high injury networks, which are really useful in terms of understanding where our injury is concentrated and how can we allocate those resources. And high injury networks are disproportionately concentrated in marginalized communities. I also want to say on the data point, it's really important for us to understand and build on the data that's included in those systems. So we also know that from our work in San Francisco that people without housing were disproportionately reflected in fatalities, but that's not a variable that that's historically collected. People with disabilities, we also have some and need more evidence regarding representation of people with disabilities in crashes. These are areas of opportunity for addressing disparities, but we need improved data and also to better understand like what are targeted interventions for these communities. But first we need to really start with having better data to inform this work. And all of these things are possible. And, I think this data issue of like using the data we have, but also identifying what data we need and building those data sources is fundamentally an issue of political will, and allocating resources. But that also starts with having clearly defined goals. I'm concerned I'm rambling now, so I'm going to stop.
Laura, I just want to add to, I think it's interesting how we elevate quantitative data over qualitative data too. I think there's some sort of connections there to the way in which we do community outreach and engagement, the fact that we don't do it well, and that some of these same people who simply aren't as comfortable engaging directly with these communities through focus groups are some of the same to elevate quantitative data over qualitative data. So intersectionality is nothing new in the Black community. We've always dealt with things at the intersection, pun intended. And so that's why, you know, it's imperative that we get more diversity within these programs so that we can start to elevate qualitative data in the way that we've elevated quantitative data. Because we are people that value stories and storytelling.
I'll also add, Charles, everyone likes stories. Everyone loves a good story. And when you were saying, I think that there hasn't been a good enough investment in qualitative data. I full disclosure, am an evaluator, so I just love data and qual and quant and mixing it up. But I'll say, we'll survey 10,000 people, but we won't interview 10,000 people. It takes a lot more time, takes a significant amount of resources, but anyone who's ever had a set of interviews knows how rich and like contextualized and specific those data can be. So I think, to Charles's point, I'm so glad you said that, Charles, is that we need to invest more in qualitative data, and we need to also invest more in connecting these data sources, not just connecting quantitative data sets, again, that needs to happen, but also doing more mixed methods work in communities to look at what we see quantitatively, what we see qualitatively, and where the gaps are, to fill those gaps with both types of data. Maybe even more so qualitative, because then you get the richness of what's happening in the community.
I could not agree more. I think, you know, we really need to start with like a more robust qualitative data, because we see the gaps, you know, in our current approach. And also there's just so much diversity, you know, across, you know, different locations. We can't, you know, generalize. We really need to do that street level, you know, research to understand what's really happening.
It seems like there's often a distrust in the qualitative data because of concern that it doesn't represent a large enough sample to act upon. And that's why a lot of agencies fall back on these, you know, injury surveillance systems that they've used for a long time, although those have inherent and systematic biases as well, particularly in terms of undercounting crashes and injuries amongst Black and primarily Latino people who may have distrust or poor relationships with going to the police to report an event. And so that's a question I think we've been grappling with for a long time. Why do we still feel such comfort with that quantitative data set, knowing its limitations, and why are we not doing more quickly to overcome and complement that with these qualitative data sources?
Yeah, and then why are we elevating as best practice what comes out of these quantitative efforts that we know don't truly represent the voices of Black and brown people? Mm-hmm. Like, it becomes the gospel, and we continue to, you know, champion its findings as if, again, our communities have been engaged in the way that it should be engaged. And I'm a huge fan of weighting data, I get it, et cetera, but it's not rich enough when you consider the amount of voices that have been left out by way of Black and brown people. And even as a social scientist, someone, you know, who respects both forms of data collection, I know that I've never met a Black person anywhere in America that said they were a part of one of those Black panels. So I don't know who they're talking to when they're talking to Black Americans, but I think it's suspect.
So go back to that. We've talked a little bit about, you know, what data are missing, but Charles, you also alluded to who's missing in collecting that data. You know, when we look at our practitioners in the field, who needs to have that power and that seat at the table to improve these data sets that we're using to define safety? Let's be more specific.
I mean, we have touched on several communities. We know Black communities, Native communities. It's who's missing, and it's so Black, Native communities, other communities of color, but those primarily, right? But just because they are disproportionately more of the deaths. But also the disabled community is missing from these conversations drastically. And also Black and Brown people who live in disinvested communities. Like, we haven't yet really talked about redlining, but redlining as a 4-decade plus practice of segregating and disinvesting in communities by grading them as hazardous is still having ramifications to this very moment. Though, like, more than at least 75% of communities that were redlined are still economically disadvantaged. They still are the communities that lack resources and infrastructure of any kind because of that what was a legal government-run racist system. So I think that the who and where they live is part of it, Laura. And I would also say the how, the way that communities are almost, I think I can safely say, never engaged in the development of a database or how a quantitative system would be established, set up, and run. How innovative would it be to engage, sadly innovative, to engage community in a real collaborative governance style practice of creating data for them, by them, and to be used to act to their benefit.
I love that. And some of the, I'm just now starting to read some of the chat. I have seen in the bicyclist community, local grassroots efforts to document data on near misses that affect bicyclists that are just systematically not captured in any of our professional data sets. So there's, yeah, I think, and I've seen some work by America Walks and other groups to try to engage more citizen scientists, or what they might call citizen, or not necessarily even citizen, but community scientists, where they are part of that design of the data that is used to measure the health and well-being of their community. I think that's such a rich area for our UTCs and partners to be working on together. So let's also go back, unless anybody wants to talk more about some of the data issues. I don't want to.
Laura, I did want to also, just elevate women and youth as other, communities to engage around these issues, particularly around, like definitions of safety and space, and then also give a shout out, community-based participatory research as another really, important model for engaging communities around these topics. And also we have had great success using photo voice as another tool, for qualitative data collection, and in a way that can really be powerful, as our stories with respect to communities documenting, the impacts of safety and transportation decisions on their communities to be able to be shared with decision makers.
Mm-hmm.
And I also love, Megan, you put that in there. You also made me think, because Laura, you kicked this off really talking about intersectionality, at least mentioning it. And think about the intersections of disabled. We haven't brought up older adults. So I'll say older adults, disabled, Black. Like, the more of these identities you layer on, the more you realize just what communities really are most in danger of death. And so I think we also have to think about our data intersectionally to really, and we would call that segmenting it. So I think we have to do that much more, and then also be building out our qualitative experience data to contextualize all of that.
I will, however, add an important point, and that is, no matter how you slice the data, it's going to go back to race or income, and it's going to show that among all those groups, Black and Brown people are suffering the most.
can I add one more on that? I'll also say, I always think about this, and that vision zero, safe systems, that desire to get to zero, that dream, if we're not addressing these disparities, like, then we won't get to zero. So it was easy to ignore when we didn't have that as our vision. That's our vision now. So then the communities that are most at risk with the largest disparities, the most entrenched, intractable problems, it seems, those have to be our focus if we truly want to get to zero deaths.
I could not agree more, and I have to chime in that if we don't address these issues, that marginalized communities will never achieve Vision Zero or any of our of the issues that we're talking about today. And I also felt like I would be remiss without mentioning we've been talking importantly about community engagement, but also given the forum here today, engagement with other disciplines. So from a research perspective, there are a lot of people working on these topics in a whole range of disciplines with a whole robust toolkit and knowledge. So just really encouraging that cross-disciplinary partnership as fundamental to innovating and being responsive to these issues.
That's a great point too, Megan. And I'm wondering if we should talk a little bit more about some of that innovation that we're seeing, because I can imagine with some of the different initiatives happening around health and equity and livability and anti-racism, some of those may have a more profound impact on safety than what we're acknowledging just within the transportation lens. So what do you think are, we've talked about the dangerous by design, those negative examples, but what stories and examples do you want to lift up that you think are really powerful, whether they might be classified as a traditional safety approach from the transportation lens or not?
I could start. I would say, since I've been on the collaborative governance train, I would say collaborative governance is a safety approach. And it's because of the obvious intentional, sort of sustained, built into the practice way of engaging community, but also because it can look a variety of ways. So one of those ways is participatory budgeting, where communities can collectively demand that budgets reflect their values. And so, for instance, in Sacramento, there's the People's Budget, Sacramento, that is a community-led project to give the community control and voice in the budgets for the city and county. And as we've talked about, like a lot of cities, maybe most, if not all, a huge proportion of the budget goes to policing. So in the city, 30% alone out of that pie goes to policing. Meanwhile, critical needs like public works, parks, youth engagement, community development only get 15% combined. So a host of cities across the nation are pushing for more control over their budgets because they know that budgets reflect our values. And right now, cities clearly value policing over every other sort of upstream public health prevention approach you can think of. And so I think we have to have that, those values have to shift, and we have to see, and the real way that they would shift is in how we spend our money.
Megan or Charles, any other examples or thoughts come to mind from the places in which you've been working?
Yeah, I would say, of course, looking at alternative approaches to law enforcement is a safety improvement. Penalizing race-based 911 calls is another safety improvement. Decriminalizing jaywalking, decriminalizing cycling, and diversifying the boards of metropolitan planning organizations. Those boards are not sending money to the communities that need them most because of local politics, and it's hurting Black and Brown communities that need these investments. And lastly, I would say having a conversation about Black males at some point would certainly be a safety improvement. I'll stop there.
Thanks, Laura. I think this is a great question. I think it's always important to kind of have, you know, as we're working on these challenges, to have like, bright, you know, the bright spots, you know, examples like top of mind. Putting my like bureaucrat hat on, I think just a lot of what I've seen in responding to, you know, the pandemic in terms of interagency coordination, you know, and the foundation that's been built, you know, through the need for local governments and governments of all levels, you know, to work together, you know, to respond to COVID. That's the same kind of work and interagency coordination that's critical to responding to all the safety, you know, concerns of our city, and partnerships with communities as well. So I think like that kind of like bigger foundational work is happening that we can really work to continue to leverage to address crises such as, you know, gun violence, traffic violence, and other issues. And a lot of cities had that foundation. I think that was strengthened, but just really continuing to build on those relationships and that framework moving forward.
Well, you all have shared some amazing thoughts so far, and I acknowledge I have not done a great job of following the chat pod. I just wanted to check in with Kristen to see if there was anything that's come out of the audience participation, or we can invite audience members to ask a question that we haven't yet touched on. We do have a few more minutes before the session closes. And I think you may also be able to raise your hand and Kristen can unmute you, but feel free to just type into the chat if you feel comfortable with that.
Mostly we've had a lot of good resource sharing in the chat pod so far today. And from our panelists too, who are managing multitasking.
Oh, you guys are so amazing. Yes, I see a lot of kudos and uplifting of some of the comments that have been said already. To our panelists, are there, okay, we see from Marianne, also bringing up the perspective of engaging victim and victim families in the data and the discussions and the planning is something that we haven't touched on yet.
I think one thing I did want to uplift earlier that I was remiss in was when we were talking about defining our terms. So we talked about equity, and I said that I quoted Dr. Jones, so there's valuing all people and populations equally, recognizing and rectifying historic injustices, and providing resources according to need. So got to do that. We also have to go a step further to embrace justice, which is all of that, but modifying the systems and structures themselves so they're equitable by default. So equity is really focused on the people and the populations. You know, we acknowledge some people are further ahead than our other like marginalized communities, so we have to give them more. But then justice is like, why is this uneven to begin with? Let's shift it right. And that's the hard part, the system transformation across our transportation system, the physical infrastructure, and then also the non-physical infrastructure, the data systems, and the way that we, as Megan noted, the way we collaborate together. Is that built into our processes and our practices and our organizational cross-agency policies? Do we have those sorts of things? So we have to changing the systems means changing everything about how we work together and how the work gets done.
Well, you're giving a really good plug for some of the future sessions in this conversation, because I think that's what we want to keep exploring.
Laura, can I say something? And
yeah.
I would love to hear Jamila's thought on this. There's been a lot of conversation about talking about racism through the lens of structural, institutional, or systemic racism. what I think it does is sort of doesn't address the individual racism that causes these systems to exist in a racist way. So I think there is a challenge there around how do we really deal with racism if we're going to continue to talk about it as something structural and not something that starts with the individual and then sort of makes its way into the structures that we know.
No, absolutely. That is such a good point, and I just love a good nuanced conversation about structural racism. I'll say, Charles, I think, again, two things can be true. I think we do have to talk about the fact that the systems and structures themselves, the policies, the practices, the way that, again, how the sausage gets made, how we just do things, right? Just the way we do it, has racism built into it, because that has been missing from the conversation about racism for decades, right? Intentionally so. But then, like, as you're saying, there are individual humans who are both personally racist, but they themselves are a structure. So if you have a president, if you have of a nation, if you have a person who's running a program, who's writing policy, right? These are individual humans doing these things. They are both personally exercising racism, and they are also part of what structural racism is. So I don't know if this is the perfect metaphor, but I could see structural racism as built out of pillars, and those pillars are people. And we have to contend with both of them simultaneously. Mm-hmm. But I don't ever want us to get caught up like in just interpersonal racism as a one-off. This is just this one person's feelings. No, this is an entire system built out of people who are infusing this into how things get done and how things don't get done, and what are the ramifications of that.
Mm-hmm.
Last point on that, Laura, is that I think I agree with the both sides approach, but if you don't get racism out of the individual, it will never leave the structure. But you can get it out of the structure and it will never leave, and it can still be present in the individual. But if you remove it from the individual, it is more likely to remove from the structure. The opposite, I don't think, is likely.
Yeah, I think that this is like where these conversations are so helpful, because, coming from the public health approach, we want to go to the system and the population and change the policy, and will changing the policy change minds? Not saying it's true, but just saying that also going one by one is also, I just wonder if it's both approaches simultaneously. And I almost feel like
it certainly is. It certainly is. Yeah. I only brought it up because I don't want people to always point towards, again, an invisible system. Not, calling it what it is. It is both. But recent conversations have been centered around structural racism and not enough talk about individual accountability within that.
And how individual human people are those structures. Absolutely.
When we were at the Safe Systems Summit, we talked about the system, but how all systems have subsystems. And the lowest, building block of a system is the individual that's wrapped within the family, that's wrapped within the community. And so it's almost that socioecologic model that we are all part of the system, and we all have some individual accountability and work to do to help design that bigger system that we all desire. So I can see that connection to the systems thinking conversations we've had.
I have a comment that I think is related, hopefully, but just in terms of these systems, I think another focus here is also just from a government perspective, being as transparent and accountable as possible with respect to how we are prioritizing and using resources within that system, and that to address structural, racism, and also to potentially limit the influence of individuals on those priorities. So what are our goals, and how are we allocating resources that are consistent with those goals? And one example of that is our work on traffic safety requests in Oakland, where we get over 1,000 every year, and that's a constituent, constituent request for traffic safety. So we've developed a prioritization model consistent with the goals of OCDOT in our city to prioritize based on our high priority equity communities, which are disproportionately communities of color, seniors, people with disabilities, and low income residents, to prioritize requests adjacent to where are more, Jamila, I'm going to start, I'm going to use marginalized where I would have used vulnerable populations travel. So schools, but also senior centers, libraries, health clinics, busy public transit stops, et cetera, and where crashes occur. So that's a methodology we use. I'll share the link in the chat, and that's something that we use to in just one piece of our safety work. But how can we be more transparent about how we're prioritizing and investing our resources in these larger discussions?
Well, I think you all have really set us up for a rich continuation of these issues, thinking about the system, these core processes in which we need to shine that light and be transparent in our language, our assumptions, what we're doing, what data we're using to reach our, if we even have shared safety goals within our communities. I think that's a real big focus that we're going to have with the rest of this series. So with that, I might turn it back over to Kristen to let folks know about the next in our series, unless if there's any other questions that you all want to ask of each other or ask of this group. If we welcome you to put in a last thought or a last plug of something you're working on or something you want to make sure that we keep talking about in this series.
Yeah, I just wanted to add, thank you so much, Laura. I wanted to add, sort of thinking more that we need to think more visionarily, right? So I think both transportation professionals, public health professionals tend to be very, very practical. I would challenge us to be more, envision a world where we could have, I think that Vision Zero, for all of the things we could debate about, sort of how the rubber meets the road, another bad pun. The vision is beautiful and is something that we aspire to. So using some more geeky, research language, the counterfactual. What would the world look like if we did these things? If we got it right? How could the world be? So I think we have to stop limiting ourselves and saying we can't do this, we can't do that. Let's think about what we can do. Let's think how we can transform things and how the world could look if we, as Charles was noting, as individual people with accountability and with more power than we realize, because we are in government spaces, we are in decision-making spaces. How can we use that power for good and in a way that is different than it's been used by others in the past? So that's what I would add.
Well,
the only thing I would add, Laura, is shameless plug. I have the Arrested Mobility podcast series coming this fall. Be on the lookout for that.
I just want to echo Jamila's closing comment. It's like, this is really heavy, heavy work, focused on kind of addressing, severe, impacts and deaths on our communities. But in order, to create the future that we want to see of a just society where we've eliminated these issues, we do need to spend time, envisioning what that looks like to get there. So we have a lot of models of the apocalypse, but actually a training I took with Starhawk a number of years ago, she emphasized that, we need to have that positive vision to move forward. So I just want to thank Jamila for that comment. And I think that's a really positive, note to end. And we need to spend time in that positive space to get, there.
Yeah, that is a wonderful note to end on. And I've taken away so many insights from you all just in today's conversation about things that I feel like are very actionable that I can work on just within my own research teams. And I think there's a lot of folks that are on this line that are feeling, inspired about what we can all do differently, individually and as part of this, safety community. How can we re-envision what our safety community can look like and can do? So thank you again for helping us kick off this session. I think it's just been really wonderful to hear. And we've got a new group of folks talking next week about our misconceptions, our assumptions, and our language around human error. And what do we mean by that term? What's loaded in that term? And I think it will connect a lot to the discussion that we've had today. So again, I really thank you all for your time and being here today. And we'll see everybody hopefully this time next week. And have a wonderful summer in the meantime.